Okay, good morning, everyone. Thanks for joining this session on urban analytics. I'm Ed Manley. I'm a professor of urban analytics at University of Leeds and a co-director on the CDRC. So the urban analytics program covers quite a broad range of activity, highly interdisciplinary, crossing across themes of health, mobility, retail, population, crime, sustainability. So you don't really need to be at the other sessions because we're going to cover them as well. But we're particularly interested, obviously, in populations, mobility, activity, and changes over time, and very interested in using new forms of data and innovation in methods to understand those patterns. And we're also adding new data sets all the time. We're adding new partners. Some of the talk today are going to talk about some of the new data sets. So if you're interested in developing joint projects, then or understanding how we might work together, then please do get in touch, but also stick around for the next session after this, which will be on mechanisms for partnerships. So today's session is going to be a snapshot of some of the work going on around urban analytics within the CDRC. There's going to be 4 10-minute talks with question and answers at the end. A lot of the work actually will be focusing on COVID. So given the interdisciplinary approaches that we embed in this program, a lot of COVID has sort of been central to a lot of what we've been doing. And 3 of the talks will focus on COVID explicitly. So the first talk will be from Susan Grant-Muller at the University of Leeds. She's looking at understanding social proximity using new data. Then I'm going to be talking about household visitation during COVID using a new form of data as well. Then Mark Green from University of Liverpool is going to talk about the Local Data Spaces project, which is a collaboration with local authorities on COVID issues. And then Jose Pina Sanchez from University of Leeds and David Buil-Gil from the University of Manchester will talk about the Recounting Crime project. So without further ado, I should also mention we have the Q&A at the end. We're joined by Alex Singleton from University of Leeds, another co-director of the CDRC. Did I say University of Leeds? I mean University of Liverpool, of course. Okay, so without further ado, I'll hand over to Susan, who will give us our first 10-minute talk. Thanks.
Thanks very much, Ed. I'm going to share my screen now, and if there are any problems, please let me know. So I'd like to speak this morning about some work we've been doing to understand social proximity with new data. And the case study we're going to use relates to public transport. However, I hope by the end of the presentation, we'll make it clear that this methodology can be used in other contexts as well. Just to firstly give a shout out to the great team who've been working on this, Dr. Yanis Boussard, Yang, Andrew Tomlinson, who've been contributing to both the TRACK project and LifeBand projects that have made some of the technologies that we're using today. So some of the background and the problem that we're trying to address with this relates to social contact. And we know that social contact is both enabled and results from mobility and is very key for social and economic sustainability. But what we found out during the pandemic, but also I think learnings from other kinds of contexts, is that we can be in contact for too close for too long. And when that happens, we can risk both exposure to COVID-19 and other viruses and other diseases, but also that different burdens arise for different population segments. So there are a lot of equity issues around that. Now, that's a little bit on the negative side of the scale, as it were, because it's also important that people have sufficient social contact, and some have insufficient, whilst others are having more than they would prefer to have because their circumstances, employment, etc., require them to be in close contact when they would prefer not to be. So it's a complicated picture, but social contact is difficult to monitor objectively. Here we're going to present the potential of some new data technologies to create some understanding of when, where, and to what extent people who are using public transport are in close proximity to others. And the other contexts will follow later. The specific research question I'm focusing on this morning is, can we utilise pervasive user-generated signal data from devices that are being carried widely now to understand when and where people are too close for too long as part of their public transport travel activity? It is a broad research programme, and we've been looking at 3 different software apps that can be carried on smartphone devices, but also a wearable device. And our definition of too close for too long is being exposed for 15 minutes at a distance of 2 meters. Now, there are lots of variables around this, and we can unpack some of that if we get time to do later. So the concept of the technology we've been looking at to try and objectively measure this is based on the fact that a lot of devices have a radio transmitter sending out signals which can be picked up by a receiver. In this case, the technology receiver that we're using is a wristband, a wearable device, and that we chose that device because not everyone has a smartphone or wants to use a smartphone. So having alternative matters. Proximity is then estimated using the received signal strength. In other words, the closer that people are, the stronger the signal, and the further they are away, the weaker it is. There is a mathematical expression that captures that in more detail than I've just described, and it's called the log distance path model. So the equation that we see there actually captures that. And we can use basic lookup tables. This is a generic equation. There's a reference at the bottom of the slide if anybody's really interested in this. So we can use some basic lookup tables that have been developed in a wide range of contexts, both inside and outside. But for us, the 2 meter distance was important. So we really wanted to be able to parameterize this ourselves using our own data. The signal will vary according to all sorts of factors. So whether you're inside or outside, the amount of different kinds of materials that are around, interference from people and bodies and glass and all sorts of things. There has been a little bit of research over in the USA, but it was lab-based. So it was based around a constructed vehicle within an artificial environment. We've been out, and the research that I'm going to describe to you now is based on our empirical findings. Just to say that as long as alongside working with this deterministic equation, we're also looking at machine learning models, which to do the same function basically, and our early results show that they are actually far superior in terms of being able to capture this. But let's start from the beginning with this work. So first of all, we wanted to, this is using the wristband, and later on I'll talk about the software app as well, but we wanted to check that the concept would actually work. So we have a prototype device. This is a trace of journeys that are made in London in and around the Hyde Park area. And the dots that you can see on the screen there are basically form a heat map. So the more dense the colour, closer to red, the stronger the signals, and the combined with the number of devices that are seen. Now, if we map across to what these locations are, where we can see particularly bright red dots of large size, we can see that these are in fact areas where we would expect to be picking up lots of devices from people. So these are areas where people are at leisure or shops, and there will be lots of Wi-Fi signals, Bluetooth signals, which are the 2 main ones that we're picking up. And this gives us some sense that this is a technology that works. In order to be able to analyze that signal data in more detail and to be more accurate about this, though, we wanted to find out what happens in our baseline scenario, which is to be in an empty rail carriage, and to understand that at certain distances, certain strengths of signal will be measured, and that will allow us to put the parameters into our path loss equation. So we went over to Hull. We had four wristband devices acting as a receiver, and a smartwatch from a general supplier of well-known brand, will be mentioned, that was acting as the transmitter. So the transmitter was on a person who moved their locations. We've got 5 locations here, and the wristband devices were static in the position as shown. We measured the distance in 2 ways. First of all, using standard tape measure type traditional measures, but also looking at maps and the measured distance according to the plans supplied to us. You can see there on the right-hand side the accuracy of the signals that are coming through and the estimated values against what they actually should be, the measured value. So the ground truth is the dotted line that you can see there. That is the actual measured distance, and the red line is the estimation from our model. We had 116 samples, so signal samples to base this on. We were concerned about overestimating distance because in the sense of health exposure, if a device is indicating that the person is further away than they actually are, then that is not capturing sufficiently conservative estimate of being too close for too long. So we've put on the second row there, you can see some results that arise from the overestimation error. There are particular places where it appears that we have both strengths and weaknesses, so accuracies, etc., and inaccuracies with the model as it is. And again, we've got some machine learning in practice, but this model in general has a good degree of fit for us and gives us confidence that this is working to good effect so far. The second example that I want to illustrate to you relates again from some empirical evidence from a long distance train case. That data that I've shown to you there is for benchmarking and for algorithmic processing, but of course we're very keen about how this works out in practice. So one of our team set off on a long distance journey from Leeds up to Glasgow via Newcastle and various other places along the way. We collected various data on this, the signal strength, which was able to give us proximity data, but also just some manual paper-based records of who was where in the carriage. This isn't ideal for us. So our person is the yellow square there, and then the red people are people around. This isn't ideal for us. So we're looking at other established forms of data to be able to give us, for example, reservation data, loading data. We're also exploring whether it's possible to get the weight of the carriage and other indicators of activity along the way for us really to be able to bottom this out. So what we can see here, this is the outward journey on the left-hand side and the return journey on the right-hand side. The heat map again is indicating instances of too close for too long. And on busy journeys, we would expect to see lots of proximity instances as we might refer to them as the journey progresses. We know about public transport journeys that they tend to be more congested in and around these origins and major cities. And as the journey progresses to more rural spaces, longer spaces, distance, then that would reduce. And that's exactly what we're seeing there. On the return journey, again, this is exactly what we would expect to see. This is a less busy service and the number of proximity instances as indicated by the technology, but also by just the plain schematics that were handwritten there as well. I can just automate that for you there, and you can see these are different devices being picked up at different points along the journey. We've got some interesting gaps which actually match with the gaps that are there on the right-hand side where we didn't appear to be picking up any proximity instances. What we believe is the case that these are situations where either the person carrying those devices moved out of the carriage, left the train, or in this case that with the pink dot we can see they pick up again and return, and that is possibly where they either powered down their device or left to go and have a cup of coffee in the buffet car. Various explanations are possible. But this all looks very intuitive to us, and that this is behaving in the way that we would expect it to. So for understanding proximity and mobility, we've got another trace going on there where, again, another journey that we can see, we're picking up different devices that joined at Berwick-upon-Tweed and left at Dunbar. And our observer in this case was able to confirm that, in fact, there were people coming in and leaving at that point on the journey. So understanding proximity and mobility, it's an issue for transport service staff as well as for the public. And although we've developed this in the public context, we need to understand that people working on trains, buses, etc., are also exposed. And this gives us actually a way of picking up that. We can use the information in the device addressed in order to infer demographic, and there is research out there that allows us to do that. Although I should say that when we use the wristband technology, that we do ask people to register and we capture demographic as well. But the more this is automated, the easier it is, I think, to pick up large volume data. So exposure during the journey can be analysed alongside exposure at the origin and destination. That's really important for this, because what we need to understand is that public transport is only ever part of a bigger lifestyle and activity. And when we look at risks, then those risks need to be proportionate to where people are spending time and other activities that they're doing. We've got a lot of further validation and benchmarking exercises underway that I've alluded to, but the longer term picture is we're going to combine this proximity data with some surface sampling that happens on the public transport itself, so swabbing for presence of COVID and other types of health burden we can get. We're doing CO2 measurements as part of the wider track project, which can give us some idea of what's happening in and around the carriage as well. CCTV data, which will give us who was sat where, or at least how many people were sat in different positions, and some established demand data, which I've alluded to as well. We're potentially looking at wastewater analysis, which comes out of the carriage, which is from the bathrooms, which can indicate COVID presence and the presence of other diseases as well. Bringing that all together, I think, should help us to create a really comprehensive picture on that. And we aim to use some spatial microsimulation methods to extend the analysis to scale, although we're looking at specific journeys to illustrate in this presentation. So future work then, the use of the technologies to better understand lack of or the appearance of social contact for young people is very much on our agenda, and we collaborate and hope to collaborate more with the Born in Bradford and the CARE network to bring our experimentation to the Bradford area. Older people and the extent to which they can come into close contact with other people is a big issue as well. So that's a social concern, but also the duration of care and the exposure or facility of care we can measure as well. And we've already got a large scale study funded involving vulnerable people, so people with a variety of vulnerable characteristics, where we can take this and understand more. So I'll close at that point and hand over to you, Ed.
Thank you. Okay, you should be able to see that. So this talk actually follows on very nicely from Susan. And it's about the use of a secondary data set for analysing mixing between households during COVID-19. So a slightly different setting, but a similar sort of issue. So as you might recall, that mixing in closed spaces is a major cause of COVID-19 transmission. And so a number of policies were put in place throughout the pandemic to try and reduce the amount of mixing people were undergoing in households. Obviously, some of that mixing, we also know, was quite confused. We went from various measures, including support bubbles, rule of six, stuff on overnight stays, Christmas bubble. I'm sure it all brings back horrible nightmares. And a lot of the media discussion was around policy adherence and the extent to which people were actually not mixing in households or following these rules. But there was very little quantitative evidence about whether there was any breaking of the rules and where that was happening. So there's obviously some data on surveys. So people were asked whether they were adhering to rules during COVID, but a lot of that is skewed by social desirability, self-selection biases, and when we've looked at other mobility data sets, such as Google mobility reports, they have been focused on visits to particular land uses rather than visits to households. So we thought this would be an interesting area of analysis and to look at the trends over space and time. So the data sets we've used are a new form of data from a company called Cubic in the US. They collect data from anonymized individuals who opt in to share their data for research purposes. They are collected via other apps, with the location-based apps in general. And we were given access to their platform to run analyses on these data. Although we didn't have access to the individual records, we could aggregate using that raw data and export those aggregate outputs. So with that platform, we're able to access data from about 1 million users in England. Not all of those go into this analysis, but that was roughly the number who appeared on the Cubic database. And our analysis window focused from pre-COVID in January 2020 to May 2021. So the data sets would look something like this. This is obviously a hypothetical user, but you get clustering as you might expect around particular locations, which would indicate stay points over a longer period of time. So we can run some analysis on these sorts of data, and the data set, the approach we've used is fairly standard. It's a clustering method called dbScan. This slide just outlines some of the sort of parameterization that we went through to select how the clusters would be formed. We then removed different types of visit points. So once we identified visit points, we removed from our analysis home locations, shop visits, or visits which were near to shop locations, points of interest, any visits that look like a workplace, so basically the second most popular frequently visited location. And we isolated only visits which occurred in residential areas according to the OS address-based data set. So we're left with a sort of quite a subset of all of the points, but we're fairly confident that they reflect visits by people to other households. And so what that is of interest is that, thinking back to the policies were forbidding this at certain times, and so some of these visits were either were necessary for other purposes, which the policies weren't responding to. And obviously, as I say, everything's aggregated. So within that process, we have this process of aggregation into local authorities, which is the sort of area of analysis we thought would be of most interest and gave us the largest sample sizes. And then we looked at variation over day as well. So we're left with a visitation metric for a region, and we can average it for a particular time as well. Should also say we also computed this around a baseline, so that we had what we're looking at actually in this is variation around a baseline from the 8 weeks in early 2020. So it's what we see is relative to that pre-COVID time. So just to give you some of the insights on the data, this is the temporal evolution, and probably the most interesting figure because it shows how visitation changed over the course of the period of analysis. On the bottom, we've just got for context the numbers of COVID cases. What we can see is relative to our baseline figure, which is marked as 0, we see obviously the first national lockdown caused a massive drop in the amount of visitation that was going on. But interestingly, it sort of climbed slowly after the initial drop of the first month. So we only ever saw a relaxation in indoor mixing in July 2020, but prior to that, people were already beginning to mix again. Whether that's inside in houses or in gardens, we don't know, but that's evident here. Because as we go into the summer, we see the amount of household visitation increase through the summer, and then we see reductions again during the second lockdown in November, although this was to a lesser extent than the first lockdown. And then we see reductions around Christmas, which was particularly influenced by the lockdowns in the southeast prior to the full national lockdown in January. But what we actually also see is an interesting increase in activity as well. From about mid-February 2021, we see this increase in activity in household visitation, quite dramatic, really, up to the formal relaxation of May 2021, and that's aligned with special date 14th February, but not Valentine's Day, but the date at which the vaccination of the most vulnerable groups was promised. And our suspicion here is that to some extent the relaxation followed that relaxation. We can also look at spatial variation. So this is by local authority, and we can see that in the southeast we saw higher levels of household visitation in general, which tracked all the way through the different periods of analysis, and in general urban areas were also experienced higher rates of household visitation. And then, we can drill down into different areas as well. So this is a comparison of Leicester and Liverpool, which had two different stories. Leicester had an extended national lockdown during the first sort of phase of COVID, and we see this in evidence by the rates of visitation in Leicester relative to the national lockdown prior to a sort of bounce back period later in the summer. Whereas in Liverpool, we know they had a sort of harsher local lockdown, and we can see that evidenced in some of the rates relative to the national lockdown here, national rates here. And these figures just go to evidence the impact of the vaccinations. You can see that this is broken down by region, and we can see that different regions have broadly similar household visitation rates during 2020, and this tracks quite nicely the rates of vaccination as well in each area. Just to finish, just 2 points on representativeness, because these are obviously new data sets. We found the data to be pretty robust in terms of how well it reflected ONS population estimates. You can see this broken down by different region sizes. We see sort of it doesn't track so well once we get down to the MSOA level, mainly because we're losing a lot of areas due to sample size issues. But certainly at the local authority level, we were quite satisfied with the numbers of users we had and how similar it was to population estimates. And this is a comparison against Google mobility reports. So we can see visitation to these different areas: retail and recreation, groceries, parks. They all sort of track similar trends, slightly different, but similar trends, which is interesting itself. The residential estimates from Google are residential relative to your own home location. So we are looking at something quite different here. So it's a new metric in that respect. So the research highlights basically how we see variation over space and time in household visitation, and it gives us some insight into the adherence to policy over space and time. The results are, interesting, but they're indicative. We're still asking questions about how biased these samples are, and ambiguity remains around how the data is generated exactly on the devices. But I think there's a lot of room for further analysis, and which we are continuing at the moment. I should also point out that the visitation measures are available on a daily basis if you're interested in exploring them further, and we're looking to export them from beyond the May 2020 timeline as well. Okay, that's me. I should also, acknowledge my co-authors, Mengdi Zhuang, Stuart Ross and George Breckenridge, and Brennan Lake at Cubic. The papers are there also if you're interested in reading further. Thanks very much. I'll hand over to Mark.
Hi everyone, so I'm Mark, and I'm going to talk for 10 minutes and 10 minutes only about local data spaces. Specifically, what local data spaces is, and talk a bit about what we did, and I'll talk a little bit about what we found. So I think, one of the key things we're kind of talking about today with the conference and the work that CDRC does is how do we make data more valuable, usable, and how do we get it to policymakers, people in local authorities? How do we get them to use data that's often quite complicated, quite difficult to use, and often, trying to appeal to get people to use data with different levels of confidence in either processing, analyzing, or even engaging directly with that data. Now, during the COVID-19 pandemic, having access to timely data has been really important, and getting hold of that data, getting it into the right hands at the right time is really been what we needed to do to make good decisions. And I think, there's been a huge amount of progress in trying to make data more available, more accessible to researchers, to local authorities, but it's quite difficult. And of course, there's a huge amount of administrative problems at the back end that kind of prevent a lot of this. At the same time, local authorities often after years and years of kind of cutbacks to their services, don't necessarily always have the technical infrastructure or the range of skills in their personnel to make the most of these data sets. And so often, it's not just a case of, build it and they will come. It's about making sure that we think around how we can make data more accessible, but also help people make the most of that and actually building capacity within those groups. And so as part of this kind of problem, really, local data spaces was born really around how can we make data more accessible, more engaging, and give it to local authorities in a way that can help them use these data, hopefully to make better decisions relating to the pandemic. And we did that really through trying to build relationships with local authorities between a group of academics. So myself, in this case, a team from CDRC, myself, Jacob MacDonald, Maurizio Gibbon, Simon Leach, as a team of researchers who could see, well, actually is building these sort of academic policy partnerships actually a really good way of doing it. So we set off from, we started pretty much from running start in November 2020. We only lasted 6 months. It was a pilot to really make sure, is this actually useful? Is it actually going to work? It might be an absolute disaster. Let's find out. And really it was about how can we open up data from trusted researcher environments that we know that local authorities weren't using. So that could be, for example, the CDRC and the kind of more controlled and sensitive data that they have hold of. In particular, we focus a lot on the ONS's Secure Research Service. Again, a sort of trusted research environment where you can access very detailed mortality data, social surveys, a whole range of kind of complicated and sensitive data. And we kind of mixed and matched a bit from the ONS SRS. We mostly relied on that, but we also brought in some of the more brilliant mobility data that the CDRC held as well. And really we was trying to make up these data and help them become more accessible to local authorities. And the way we went about this was sort of three approaches. So we started talking to local authorities and we try to identify, is there an interest? Is there actually a need in using some of these trusted researcher environments? And where we found that local authorities, they were interested, they felt like they had enough time, resources to make the most of these things, we would help them put in applications, whether that's to the ONS SRS or to the CDRC, and just walk them through exactly what they need to do, what makes a good application, just help them put it in. And of course, this allowed local authorities then to directly conduct their own analysis and actually engage with data that they weren't using before and actually helpfully make better decisions. So, for example, we helped Hackney, London Borough, put in an application to the ONS SRS, and they were really interested in the impacts of COVID-19, the pandemic, and how it was changing inequalities relating to work. So, for example, if a taxi driver falls sick, that means that they might lose a couple of weeks employment because they're self-isolating. How does that have a knock-on effect in terms of their income further down the line, and does it produce a sort of circular process? Unfortunately, there weren't that many local authorities who really felt like they had the time and resources to make the most of these trusted research environments directly. But a lot of those were really keen still to get that data out of that. And where we did find these local authorities, and these constitute the majority of them, what we ended up doing was going for a more kind of co-production element to kind of design analyses with local authorities. So we would spend a lot of time talking to them, understanding their needs, trying to come up with research questions together. We take those insights and we go into the trusted research environments ourselves and actually do the analysis on their behalf, which would allow us then to go back to them and say, is this what you wanted? Or what would you like to see from this? And it became an iterative process that would allow us to produce the kind of evidence that they needed, which meant that local authorities could indirectly use and benefit from the data within these trusted research environments, even though they didn't necessarily have the technical or the time to make the most of it. But we also knew that because this process, if we could do it for one local authority, we could probably do it for all of them. We ended up setting up with an approach where we would just simply loop our analyses through all local authorities, because we assumed that the questions the local authorities we were working with were probably being asked by all of them. And this then allowed us to produce the same data insights for every local authority in England. So, for example, we worked with York on some work around tourism. We worked with Market Harborough, in particular, making the most of the kind of footfall data that we have in the CDRC. And we also supplied a lot of evidence in the Liverpool mass testing pilot back in November 2020. We also had a sort of third approach, which was really the roadshow model, in that we would go and present a lot of these data, these reports that we were doing. And we would try and just showcase to other local authorities or other groups what we could do, which would get us a lot of local authority feedback on what they'd like to see, what they thought was good, what they thought was bad, which would then allow us again to iteratively refine our reports. And it meant that local authorities who weren't directly engaging with local data spaces could benefit, and they could actually feed into this process and gain data insights from that process. So, for example, I went to a talk for Public Health England when it existed, and presented some of the work we were doing on occupational inequalities. There was someone from Hull there who said, oh, it's fantastic, this is what we needed. We didn't have any data on this. We were really interested in which occupations were more likely to have tested positive. Can you do us something like this, but for Hull and the East Riding, and just tweak it a little bit? And this then allowed us to help and produce the evidence that they needed to make the decisions that they wanted to do at the time. So the result of this was that we worked with about 25 local authorities across England, and the end product was that we produced 10 short reports for all 314 local authorities in England. These are openly available on the CDRC website. If you navigate to the geodata packs, you can download them for every local authority for free. You just have to log in. And the 10 short reports really are what have come out of this process. They present data insights for each local authority around key aspects of the pandemic. We also managed to navigate and change what we were doing to produce more bespoke reports depending on what people needed, and being able to change very quickly to do national level stuff as well as the local stuff. For example, engaging with SAGE to produce evidence alongside the ONS that fed into some of the debates that were going on in SAGE at the time. And we also made everything openly available. So we have our GitHub page, it has all of our code on there, and this allowed local authorities to say, they saw what we did, they wanted to go and then use the SRS, they could just take our code, import it in, and rerun it and reproduce everything that we've done. So that's local data spaces in just about 10 minutes. I look forward to taking any questions in the Q&A session later. Thank you very much, and I will pass over to the next speaker.
Hello, everyone. Hi, I'm trying to see if I can share my screen.
You can do it. Yeah.
Here we go. I've got it now, I think. I've got it. David, can everyone see the slides? All right. So if so, I'll get started. Yeah, thanks for inviting us. So 1 second, you can, Yeah, thanks for inviting us to present our project. Our project is called Recounting Crime. It's a project funded by the ESSC, but we also have the CDRC as one of our partners. And it's a project that deals with the problem of measurement error in police recorded crime data, or police statistics, just for short. It's a project that we've been working on now for about a year, maybe a bit more, a year, a few months. It's led by Ian Brantner-Smith from Surrey. In Manchester and Leeds. We're all quantitative criminologists, sort of, by background, except for Alex, who is a survey methodologist. And if you want to see what we've been up to, you can go and check it out on this website at recountingcrime.com, where we've been collecting all our outputs and all our activities. So in essence, I'll try to very briefly provide an overview of what is it that we're doing in this project. And then I'm going to hand it over to David, who is going to talk in a bit more at length about one particular application, which might be particularly relevant to the work, some of the work that the CDRC and the partners are doing. So David is going to be talking about how we're creating a synthetic data set of crime or crime rates across the whole of England, across the, different area units, local authorities, MSOAs, LSOAs. But yes, as I said, just very briefly, let me introduce you, give you a little bit of background as to what is the, the bigger picture here. So what we're trying to do is explore the question of measurement error in police statistics. And the problem there is that, well, it's a well-known problem amongst criminologists, at least, that, like the crime reported by, or recorded by the crime data reported by the police is really subject to multiple limitations. On the one hand, the main issue really is that not all crime gets reported. So it really systematically underestimates the true extent of crime when we rely on that data. Then there are also issues of variability or inconsistencies across police forces in how crime is recorded. There are also issues with how proactive different police forces are, how effective they are detecting crime, of measurement error affecting these data. Now, this matters really because in our view, really, we've come to the conclusion after, like conducting, we had this intuition, but we've come to the conclusion that, really this is the biggest data source really used to understand crime. That is by no means is the only source of data to look into crime. We're seeing more and more new forms of data looking into crime, but it still is, the most important one. Is heavily used in countless number of studies, academic studies, which of course, will be affected by as a result of using this data that is affected by measurement error. But it's not just academic studies, it's heavily relied upon by policymakers, and not just policymakers, but specifically by police forces. So it's used to assess, policing strategies. It's used to assess, for example, how resources are going to be distributed across different police forces. So yeah, it's a big problem. So in this project, what we're trying to do is three things. It's all structured according to three main strands. So first of all is try to document the problem. There's been quite a lot of work historically carried out over, longer than a century on this. However, the difference or the novelty, what we're trying to do this here, what we're trying to do differently here is document the presence of measurement error by trying to document it formally. So try to look into, okay, how does this measurement error look like? Is it systematic? Is it random? Is it additive? Is it multiplicative? Is it differential? Is it non-differential? So how can we define it formally? And once we do that, then we start, we move to strand 2, which is to start looking at what is the kind of impact that we should be expecting, what are the biases that we should be expecting when we use this data. And then on strand 3, which is what what David is going to be talking about, we're trying to look into potential solutions. Work now, hopefully we get it published in a couple of months, a sensitivity analysis tool that we're going to turn into an R work package, so people can conduct this kind of analysis and assess, what will be the impact of relying on this data themselves. We've also suggested a few other ad hoc solutions or adjustments, but I think the most promising solution really is what David has been working on with a few other of our members, of team members, which is to create new forms of data that are already adjusted for the problem of measurement error. So in a way that are taking into account the fact that there are issues with police data. And that's exactly what David is going to do now. He's going to talk about that part of our project. Now, I'm going to try to stop sharing my screen. So I'm going to let you do that. David, is that okay?
Yeah, I'll try to do that.
So here we go. I think I just disconnected my screen. And I'll shut up now. I'll hand it over to you. Thanks.
Okay, so now I can only see my screen, but I will just assume that you can see what I'm sharing. Yeah, so as Jose has been saying, as part of the project, we have done some overarching work about how this problem of measurement error in crime data affects our explanations of crime and deviance and its distribution across geographic areas. And we have also done some work about how it affects descriptive statistics and that are used for crime prevention strategies, right? So we know that we only have a few minutes left, but we wanted to present at least a piece of empirical work showing the type of work we have been doing to try to correct for some of those measurement error issues and try to come up with an alternative data source that can be used both to test theories of crime and deviance and for crime prevention. This is a work in progress. We have published our first version of the synthetic crime data that we have developed, which is supposed to correct for some of these biases of underreporting and underrecording. But we know that there are loads of experts in geography and synthetic data here. So all your feedback will be welcome. So what we try to do here is try to generate a synthetic crime data set at the level of output areas in England and Wales that can be used for a variety of purposes. It can be used, for instance, to assess the extent to which new methods designed to estimate reliable estimates of crime in geographic areas are actually providing valid measures of crime. But also, if we can prove that this is a good alternative data set to measuring crime in geographic areas, it could be used for crime prevention. So which are our steps to generate our synthetic population of crimes in England and Wales? So first of all, we access data from the census 2011. We will be able to do that again when the census 2021 is published. And we access data from a series of variables at the level of output areas. For all output areas in England and Wales, we record data about the age, sex, income, education, marital status, and ethnicity of local populations. And then we follow the multivariate truncated normal and binary distribution, as others have done, based on those empirical parameters coming from the census to generate our synthetic population at the level of output areas, right? But then this is the novel part, at least from our side, is try to generate synthetic victimization for all of our synthetic individuals generated in step one, right? So to do that, we access the data from the crime survey for England and Wales for the same year, 2011-2012, and then we estimated negative binomial regressions, a very simple regression that can be very easily reproduced for 3 types of crime: violent crime, property crime, and damage. Then by doing that, we estimate a series of regression parameter estimates for the same independent variables that we had generated before, for age, sex, income, education, marital status, and ethnicity. That means that we can just use these regression parameters to generate victimization in our synthetic population following a negative binomial model in the population. I know I'm almost running out of time, and just to show you the extent to which this synthetic population is reliable. So we're comparing our aggregates at the level of output areas in our synthetic data and in census data. So it's almost perfect for the age of individuals, also very good indicators for sex, proportion of ethnic groups, and so on. So we are very happy with our synthetic population. And then what we do is, once we know how many crimes have happened in our theoretical scenario in each community safety partnership, that could be something like local authorities. We select only those that in a theoretical scenario, again, would have been known to the police and compare it to actual police data. So it's not 100% perfect, but the correlations are quite high, right? For violent crime, we see a correlation of 0.83, for property crime 0.85, and damage crime 0.80. So this should be improved and needs to improve, especially because, as you see, the dimension of our synthetic population, especially for damage crime, does not really directly align with that of police records. We need to see what's happening, but I think we're moving in the right direction. And then we knew that in the CDRC, many people are interested in geographic analysis and this type of local indicators of spatial association, and I think that Ed presented some before. So in that sense, I think we just wanted to show one example of what can be done with our synthetic data, right? We can compare, for instance, all synthetic crimes against synthetic police crimes against synthetic survey data. So what we did here, for instance, is reproduce the sampling design of the crime survey for England and Wales to sample from all synthetic crimes, right? And then we can estimate from our 3 data sets and which areas would show a high measures, which areas would show low, and we see immediately that in police data does not directly align with the estimates we would obtain with if we knew all crimes that happen in society. And this is even worse when we use survey data. So for instance, police data would overrepresent some areas of Manchester, and I think that's Leeds, and obviously some areas in London. Apparently the areas in London would still remain as high crime areas, but here not all areas in Manchester and the Northwest would be identified in this, if we knew all crimes, right? Like, again, all this is a theoretical scenario based on loads of statistical assumptions, but we can use it for a variety of purposes. And I know I'm running out of time, so I'm just gonna finish. I'm just gonna say that we believe that we need to develop this approach further, and any feedback will be very much welcome. This can be an approach, an alternative approach to police records, if we can prove and we can come up with a reliable way to generate this synthetic data set. Not only that, but this is also a confidentiality-friendly alternative to crime statistics, in that it can be openly published and it does not affect the confidentiality of individuals represented in the data set. But more work is needed to ensure that this data set is reliable and can be used for crime prevention in geographic areas. So thank you very much for your attention. Sorry about having overcome the time for a couple of minutes, and we will be happy to answer any questions, of course.
We've just had a question from Ollie in the chat for Jose and David. Do you want to respond to that one?
Yeah, David, why don't you go ahead and explain, like the police formula, because you can talk more about, the impact that we've had already regarding the police formula, some of the police forces that you've been in contact with.
Yeah, so one member of our team, Ian Brenton Smith, has been in contact with different police forces to try to at least explain them what we've been doing so far, and that we're trying to develop alternative ways to measuring crime in geographic areas. From my side, I think we need to be very, very careful and not oversell what we have been doing. I think we are on the right track. I think we will eventually develop a data set that's reliable enough and accurate enough to be used for policy making and for crime prevention practice. But I think this is going to take some time, and I wouldn't want to ask police forces to use this for crime prevention if we are not 100% sure that this data set is reducing biases instead of increasing biases. But yeah, I think police forces are interested for sure in using this. We also know that a company was created recently in South England to try also to develop synthetic crime data. So there are also businesses developing related data sets for prevention. I don't know if Jose, you want to add something?
Yeah, no, yeah.
Jose, you're on mute.
Sorry, I clicked twice. I clicked a typical mistake. So yeah, I was going to say that one concrete form of impact that we've had so far, on top of what David said, is that the police, how resources are distributed across different police forces is based on a formula based on different characteristics of the areas that characterize, the areas where the police forces operate. One of the key variables that they use is the amount of crime recorded, and they've been using that for some time. So our principal investigator, based on one of our initial papers, which is still a preprint, but hopefully will get published soon, we identified like some simple adjustments. So before we get, until we get, all this new synthetic data tested and working, and that we can suggest police forces to use it instead, there are some easy, really low-hanging fruits in terms of easy statistical adjustments that they could use. So whenever they use this data, they minimize the impact of the measurement error. And that's what we suggested them to do. And it seems they're going to take it on board. And that could definitely help a lot, to distribute resources across police forces in a less unbiased way, which would be pretty important, I think.
Are there any other questions from the audience? If not, I've got a couple of questions on where we haven't got a lot of time. I don't see anything in the message, but I'll keep my eye on that. Question for Susan, really, and I thought you had a great talk. I was quite interested in the maps you had of trains, and whether what you were showing was, obviously because they're mobile, whether actually the fact that they're moving has any impact on the things that you're trying to measure. I'm very unfamiliar with the technology you were talking about.
Yeah, I think that's a great question. So when we use the path loss model, we can look at things from a static point of view, and we can look at it from a moving point of view. And we can do different kind of validation tests with both of them. On this particular occasion, we were using a static carriage, which was a real live train sat in a particular station, Hull station, in fact, where passengers had just got off. So this was a very realistic environment. We have taken some measurements also within moving trains, but they did have some people in. So I think that's the next step for us. We're also going to repeat this validation exercise with buses, so empty bus and moving bus without passengers in, to see if there is any difference. I mean, fundamentally, I think that the main source of interference is likely to be from the infrastructure around, but we really don't know until we've tested this.
I mean, I think the interactions that you're talking about in some of your future work as well around airflow and how that's kind of affected by sort of the volume of people. I mean, I've been sort of trapped on sort of packed trains from Liverpool to Leeds a number of times, and airflow certainly does go down at that point. So I think that's all going to be very interesting to see where that goes in the future. Ed, on your talk, at the start of it, you were talking about some of the map matching that you were doing between the mobility data and the locations of where different points of interest were. You mostly considered those in sort of discrete terms, so people's home or retail locations. But in some of those locations, obviously the use of those spaces is likely to be quite mixed. And I wondered if you had to think about that and whether you thought that might impact some of the things that you have sort of concluded.
Yeah, that's a good question. And sort of similar to what Ellie asked in the chat, but we did basically remove from our household visitation rates anything where a visit was near to a point of interest, so 30 meters within a shop. It could be a bus stop, could be any kind of point of interest, and therefore I think we're biased towards underestimating the amount of household visitation in denser urban areas and mixed developments. And so when we looked at the maps, we showed the regional variations, showing London much higher in terms of these household visitations. We're still actually probably underestimating the amount of visitations that are going on in those spaces. But we still need to dig more into it. I think that's what that, we actually currently have access to that data, so we're trying to understand it a bit more, but it's definitely a limitation of that first iteration of the model.
And I also wondered whether there was any urban-rural bias in it, in terms of the volume of data that you were collecting, and then extrapolating from that what you can actually sort of conclude reliably.
We didn't see urban-rural biases. Precisely, not that I recall. We did see a slight bias towards the southeast, so more users in the southeast, but it did seem to extend beyond the borders of London or the sort of denser urban areas. As far as I understand the generation of the data, there is a bias towards the types of apps that the Cubic API is embedded in. So I believe they're more towards mobility apps, weather apps, and so that therefore brings a bias as well in terms of who will be using it. So more likely to be train users, for example, and that sort of plays out when we look at the numbers of users. As COVID has continued, it has reduced, which we suspect is people dropping off because they're not using these train apps or these mobility apps. So again, it's sort of we're still grappling with trying to understand the data as much as sort of show interesting results with all our caveats as well.
That's great. I think we're almost out of time, but just to squeeze a quick one in so Mark doesn't feel left out. With all the data that you had access to in the local data spaces project, was there anything, a really killer data set that you thought you'd like, which wasn't there? And perhaps we could have a chat with the ONS about how we might make that available.
I think the thing that kept coming up again and again from local authorities was that they wanted data from DWP, so Department for Work and Pensions, or HMRC, so sort of anything on income, on employment, on occupations, on benefit claimants, because we don't necessarily have all the data, and DWP like to keep the data to themselves, as do to HMRC. So I think finding ways to broker those relationships, get those data linked to other sources, whether it's geospatial data, whether it's the sort of social survey stuff, I think that's the sort of things that we want to be doing.
Great, thanks, Mark. Back to you, Ed.
Well, thanks everyone for coming, and thanks for your talks as well, everyone. And thank you, Alex, for some great questions there at the end. I am also meant to say, if you'd like to find out more about these projects, then please, or how to get in to work with CDRC, please visit our website or get in touch. Thank you.